Thank you, Mr. Chairman. Mr. Secretary, I have two questions. And I want to start, I think, looking back on my career in Congress, I've been really blessed. One of the things I'm proudest of, and I think the most consequential, is the work this committee did, Democrats and Republicans together, to end surprise medical bills across America. I think it's so key, the work that we did, and I'm really troubled about HHS's rollout of this landmark law. We were very careful, and again, I'm proud of the work that the chairman and I did and our members, craft a bill that didn't set rates for payment of out-of-network services. We established instead a level playing field that didn't tip the scales, and a lot of people wanted the scales to be tipped in a way that it either tipped it to the patient's health plan or their provider. And if we'd have gotten that wrong, patients would have suffered through more narrow networks and reduced access to care. So after an initial HHS rule that missed the mark by a wide margin, in my view, did exactly the opposite of the clear letter of the law, the courts have acted and corrected the rule to reflect the balanced process included in the law that we passed. So can you tell us now why, after Texas District Court's judge ruling, the administration intends to continue delaying the implementation and wasting resources appealing this decision and pursuing an approach that, in my view, flies directly in the face of the law that Congress passed?
Congressman, first let me say thank you for the opportunities you and the chairman have extended to discuss the No Surprises Act. I know how important it has been to you and members, actually all members in the House and Senate have mentioned this to me. We will continue to speak to stakeholders and talk to members of Congress. We're in the process of trying to issue the final rule that will implement the law. We're going to continue to enforce where we can in accordance with the court rulings that we've had issued. And what we're going to try to do is continue to keep patients out of that food fight that exists sometimes between the providers and the insurers, so that every patient knows that once they see their medical bill, they won't be surprised when they get home, won't get broadsided by some additional medical bill that they were not expecting. So we'll look forward to working with you and appreciate the guidance that you all have offered.
Thank you, Mr. Secretary. And my advice would be, don't wait for the court's process. We wouldn't be in court if the rule had been written to the letter of the law. So the sooner we implement this together, and this is one of those issues we've worked together beautifully in a bipartisan way. We're eager to work with you on implementation on this, what is, I think, a historic landmark and bipartisan bill. Second, very quickly, last year HHS announced the largest premium increase in Medicare history. And in January, you instructed CMS to reassess the premiums for 2022. Yet, to date, no one at the agency has been able to answer our questions or give us any more details about the potential changes. And we understand from the hearing yesterday, you noted the agency continues to work on the reassessment. So we're nearly a third of the way through 2022. Where specifically are we in the process of changing premiums? What's your timeline on announcing it, and how do you plan on implementing that change?
Congressman, great questions, because those are questions I have posed to CMS over the last several months as we try to make a full determination of any action we take after the initial actuarial determination on Aduhelm, which is the drug that has caused the need for the redetermination to exist because of the high price and the changes in the price and the actions taken by CMS when it came to what kind of coverage it would get under Medicare. What I can tell you is that the actuary has essentially come close to completing the work done on the pricing element of Aduhelm. We now have the redetermination, the determination of national coverage that was made by CMS that also differs from what the actuary expected back in the fall of last year. And so we are now asking the actuaries to take a close look at that so we can get a final count on where we stand, given that Aduhelm has changed in character from when it was first considered by the actuaries way back in August, September.
Given all that, do you expect an announcement on those pricing changes to be within 60 days, within 90 days? Obviously you're working toward a timetable. Can you give us some insight into that?
Congressman Brady, I think we will, within HHS, be approaching the conclusions probably somewhere in that timeline. The difficulty is any action will include more than just HHS, CMS action. So, for example, if we were to go through the process of saying to Americans under Medicare that we're going to make adjustments, that would be done through a process that would have to include Social Security, because they're the ones that would issue any changes in checks. So it's a process that would include more than us, but everyone is waiting for CMS to give us that final outcome so we can then see what it triggers.
Do you expect from your side a 60 to 90-day timetable is reasonable for an announcement?
I would say yes, and I have asked CMS to give us a clear sense within HHS when we could move, because, as I said, there are other stakeholders that would be involved in the process. So we're trying to move it, but what we're trying to do is make sure that whatever the outcome is, we can live with it and go with it instead of have to go through another readjustment.
Understand, and you were very generous.
Thank you, Mr. Brady. Let me say, Mr. Secretary, as well, that I share Mr. Brady's view on surprise billing, and I anticipate and hope that the Ways and Means position will prevail.